Hello, everyone. Thank you for joining us. I see more people have joined. Today, the microphones are muted to avoid noise interference. The chat feature of this meeting is turned off. However, you may ask questions at any time by clicking the Q&A button at the bottom of your screen and typing in your questions there. If you are joining us by phone, you can email us at communications@pmh-mb.ca, and we'll address all questions live at the end of the meeting today. This meeting is being recorded and will be available on our website by end of day today. Our annual report and financial statements are also available on our website at prairiemountainhealth.ca and by clicking on About Us in the main menu. We will begin shortly. I see the numbers are still climbing for people joining us, so we will take another 2 minutes just to give people time. The microphones are muted to avoid noise interference today. The chat feature of this meeting is turned off. However, you may ask questions at any time by clicking the Q&A button on the bottom of your screen and typing in your question there. If you're joining us by phone, you can email us to communications@pmh-mb.ca, and we'll address any questions live at the end of the meeting today. This meeting will be recorded or is being recorded and will be available to view on our website by end of day today. Our annual report and financial statements are also available on our website at prairiemountainhealth.ca and by clicking on About Us in the main menu. Okay, I think we're going to get started. It is 12:02. And again, I just want to remind everyone and let people know who didn't hear me before that the microphones for everyone are muted to avoid noise interference today. The chat feature of this meeting is turned off. However, you may ask questions at any time by clicking the Q&A button at the bottom of your screen and typing your questions there. If you are joining us by phone, you can email your questions to communications@pmh-mb.ca, and we will address the questions today live at the end of this meeting. The meeting is being recorded and will be available to view on our website by end of day today. Our annual report and financial statements are also available on our website at prairiemountainhealth.ca and by clicking on About Us in the main menu. And Lon, I will pass it over to you.
Okay, thanks very much, Carrie. Good afternoon, everyone. I'm Lon Cullen. I am chair of the board for Prairie Mountain Health. And on behalf of the board of directors, I would like to thank everyone for coming out to our annual general meeting today. Before we begin, I would like to acknowledge that Prairie Mountain Health provides services in facilities and sites located on the original lands and territories of the Cree, Dakota, Ojibwe, Oji-Cree, and homelands of the Red River Métis. Prairie Mountain Health respects that the First Nation treaties were made on these territories, and we dedicate ourselves to continued collaborations in partnership with Indigenous populations in the spirit of reconciliation. Just a word about the board. Prairie Mountain Health currently operates under the direction of an 11-member board appointed by the Minister of Health. I want to acknowledge our current board members, who are Donna Davidson, Shannon Knight, Carla McLean, Judy Swanson, Jody Parsonage, David Moreau, Lori Rodich, Wanda Sandy, Wade Schott, and Shep Castra. I'd also like to acknowledge Brad Collette, who served temporarily on the board and had to leave due to family circumstances. Although the board of members reside in various communities throughout our health region, they represent the entire region at the board table. Through provincial legislation, the board plans, manages, delivers, monitors, and evaluates regional health services. The board does this in a variety of ways, including providing sufficient oversight measures and ensuring the organization's accountability by monitoring and evaluating its performance and establishing a 5-year strategic plan. At this point, I'd like to say thank you to our executive management and leadership team. We sincerely thank you for all of your leadership, dedication, and commitment over another challenging year in healthcare. To the staff across our system, there are not enough words to say thank you for your contributions each and every day. Day in, day out, you ensure the best possible care and service is provided within Prairie Mountain Health. Your dedication and commitment to providing healthcare in the region are extraordinary. Your compassion is exemplary. Thank you again. I'd also like to say thank you to our community partners. Thank you for working with us, challenging us, supporting us, and being patient with us, especially when these times appear to be getting difficult. I would now like to introduce Prairie Mountain Health Chief Executive Officer, Brian Schoonberg. Brian.
Thank you so much, Lon. I'd like to thank the Board of Directors for your support, direction, and commitment over this past year. And you are correct, we had another challenging year. I'd also like to say thank you to our staff, to our managers, physicians, volunteers, for all of their dedication and commitment over the last 12 months. We have over 7,500 employees on the PMH staff team. We know that they are our most valuable asset. Thank you for all that you all do. Over the next year, the Prairie Mountain Health Board and Executive Management team will continue to advance our strategic goals in connection and coordination with our partners. Our main partners are Manitoba Health and Shared Health. We also commit to ongoing community engagement with our stakeholders in the Prairie Mountain Health region. So on that note, I am very pleased to present this video. It features really a quick look back at some of the highlights pulled from our annual report and from our strategic plan. And they all relate, of course, to the 22-23 fiscal year.
Healthcare recruitment and retention remains a top priority throughout the Prairie Mountain Health region. PMH has participated in several initiatives to address nurse vacancies, including new mentorship programs and financial incentives. Post-secondary institutions are increasing the number of nursing seats, and Assiniboine Community College announced rural rotating practical nurse training opportunities in Verdun and Neepawa. PMH was also part of the recruitment mission to the Philippines. Prairie Mountain Health is working to address the physician shortage. One initiative is the International Medical Graduates Program, IMGs, which assists foreign-trained doctors in obtaining their medical license to practice as family physicians.
We could do that. Wasn't she started on?
Dr. Atella is an IMG physician practicing in Verdun.
It's actually a good scope of medicine. Rural communities usually provide you with diversity in everything because you do family medicine like a primary care practice. At the same time, you might end the day with emergency coverage and hospital as well, with admitting patients, with some procedure in the morning. So it's kind of everything you can do. It's very nice mix of everything that you might not be able to do anywhere else.
IMG physicians agreed to practice in their respective communities for 4 years in return for regional sponsorship. IMGs are in Neepawa, Roblin, Russell, Verdon, and Swan River.
Hemoglobin is quite low. We should probably order.
PMH has hired more physician assistants, PAs, and clinical assistants to expand primary care availability. Troy Smook is a PA at the Brandon Regional Health Center, mainly in the orthopedic program. He likes the time that he is able to spend with patients and also being able to assist in the OR.
I'm basically the attending for those people. The surgeon is ultimately in charge of them, but they entrust me and my colleague Christian to do the daily rounds, do the daily orders, check up on blood work, check x-rays, do all the consults if they need medical or anesthesia or other specialty consults. We do all the discharge summaries, we do all of the discharge prescriptions, and we just make sure that the patients are well taken care of before they go home.
Hello, my name is Charnay. I'm a physician assistant working with one of the doctors here at the clinic. Is that all right?
Charnay Betcher is a PA based in Swan River, her home community. Her role as a PA is in the primary care setting. She works at the Swan Valley Primary Care Center as part of My Health Team. PMH initiated a program for experienced baccalaureate nurses to consider enhancing their skill set to become nurse practitioners. The program included loan support and required a return of service agreement. PMH MPs serve 27 communities, with shifts in the mobile clinic, medical clinics, and 7th Street Health Access Center in Brandon. In addition, this past year, PMH hosted numerous career expos throughout the region, highlighting the many job opportunities available. The Stevenson Review was commissioned following a significant COVID outbreak in a private personal care home in Winnipeg. As part of the review on personal care homes, in collaboration with Shared Health and Manitoba Health, PMH moved forward with new provincial infection prevention and control positions that oversees practices that staff follow in PCHs.
Now with the gloves, we want to ensure that when we pull them on, that we are pulling them up over the cuff of the gown. I feel that having an on-site infection control support associate is important for our long-term care sites because we know our staff work really hard to provide direct care to our residents. And infection control is one of those outside factors that sometimes needs just a little extra reminder. So when we have someone here who is able to educate and teach and direct at the same time, I feel that we're just offering that extra safety measure for our residents as well as our staff who work in these sites.
Come in. Hi, Anton. How are you? Good. How are you?
Good. I got your pajamas.
Okay.
Your laundry. How are you doing today?
Good.
Good.
Also part of this review was to enhance recruitment and retention, including designated grants to support hiring more healthcare aides in personal care homes. We cannot forget about the health and well-being of our hardworking and dedicated staff. Thanks to the Employee Wellness Committee, employee fun days were held, like this ski trip to Assisipi. Funding grants were also available for staff to put towards a fun event such as a barbecue, bowling, or paint night. Staff development worked regionally and provincially to offer support and education for managers to help them provide the support their staff needed. Leaders were also invited to attend virtual workshops on building resiliency. The mobile clinic provides primary care services for people living in or near some of our First Nations communities.
Okay, let's take a peek at your throat. Good. Say
The Clinic on Wheels offers a full range of services such as physical exams, harm reduction, immunizations, family care, and referrals.
Nurse practitioners are advanced practice nurses, so we've got a master's in nursing, so we can do things like prescribe medications, order blood work, order CT scans, MRIs, refer out to specialists if needed. a full assessment of patients.
He's got some really awful eczema on his forearm.
I think the more barriers that we remove to have access to healthcare, the better it is for everyone. And this is transportation is a huge barrier for a lot of people. So coming straight to the communities, we are able to see people who don't normally go for primary care visits.
Another valuable partnership is with the Sabatoyak Cree Nation. My Health team provides outreach to serve clients in their homes, community settings, and remote locations.
Hi, I'm Carly. I'm a nurse with the Healthy Sexuality Harm Reduction Program, and we're going to do some testing today. We're going to do blood work for Hep B, Hep C, HIV, and syphilis.
Outreach and public health community clinics offering services such as immunizations, harm reduction, and STBBI testing are ongoing in the region. Clinics at Princess Park and Richmond Park Church in Brandon, the Primary Care Outreach Clinic in Dauphin, or the Community Connections van that visits a number of communities on a regular basis. PMH expanded its Indigenous Health Program. 3 Indigenous health client advocates help cultivate relationships between Indigenous clients and healthcare providers.
I look in on patients, visit with them. If the patients have any concerns about how they're being treated, what their care plan is, I liaise with social work, doctors, nurses, PT, OT. I attend family conferences. I go out into the community of Brandon to go to 7th Street Health Access Center and Public Health.
I grew up in an Indigenous community. I am Indigenous myself. And when I grew up seeing my parents face, healthcare, like the healthcare system back then, I just want to be a part of the healthcare system now, making sure that my Indigenous people, that they receive the best quality care that we can give them.
The Stevenson Review made several recommendations to enhance residents' care in our long-term care facilities.
Hey, Betty. Hi, I got your hair towels here. Super. Hi, Doreen.
Personal care homes in PMH started to hire and expand their staffing levels and allied health resources. Residents have more access to recreational activities. The region also has a new long-term care access coordinator, the regional point person, to coordinate and manage the PCH waitlists, including the movement of clients to transitional care units or PCH beds from acute care or community. Through a partnership with Shared Health and Health Canada through the Substance Use and Addictions Program funding, mobile access to addictions medicine, RAM clinics, have expanded. Clinic days have been set up in Russell, Wayway-Sikapo, and Wisquay-Sepik First Nations to improve client access to addiction medicine. PMH has worked towards implementing a medical withdrawal management service consisting of 4 beds within the Brandon Regional Health Centre. This service supports individuals requiring medical support to withdraw from substances and connects them to resources on their recovery journey.
So she's going to be in medical admission, but she will at some point need.
In addition, mental health liaison nurses provide coordinated care for individuals who present to the emergency department with mental health or addiction concerns. They provide assessments and recommendations for care, as well as connect individuals to resources. Prairie Mountain Health currently has several capital projects underway. BRHC Critical Care Project will include a new 16-bed intensive care unit and 30 additional medical beds. The Western Manitoba Cancer Centre's 7,000 square foot expansion and renovation is underway, which will see additional exam rooms and treatment spaces. It will also include the Center of Hope, an area for counseling and support. When complete, this facility will have a second LINAC machine for radiation therapy. A new hospital is being built in Neepawa, Among the features are 60 medical beds, 4 labor and delivery rooms, 14 emergency treatment bays, cancer care services, and renal dialysis. Renovations to the Dauphin Regional Health Center will convert the former emergency department space into enhanced patient care areas, including a new endoscopy suite and chemotherapy unit. Emergency department renovations are nearing completion in Verdun, Killarney, and Souris. These renovations allow for dedicated space for registration, treatment space, and improved wayfinding for patients. Construction is underway on the building addition to expand the cancer care unit at Russell Health Center. The expanding Community Cancer Care Committee raised $1.8 million towards construction and equipment costs related to this project. Plans to install a CT scanner within the Swan Valley Health Center in Swan River are progressing, and the equipment has been ordered. The province committed $2 million to the initiative, and the surrounding communities were contributing $1 million. In conclusion, PMH recognizes and says thank you to the many foundations, auxiliaries, and community groups and individuals who donate money to our healthcare facilities for the betterment of our staff, patients, clients, and residents. We also recognize and celebrate all the efforts, achievements, and contributions made by our staff and volunteers every day in our facilities across the region. We are all part of a team, regardless of what community and position we hold. We recognize them throughout the year. Thank you for your dedication.
Thank you very much. I just want to thank our communications team for the great work they did on that video. As mentioned, the AGM video will be posted on our PMH website and also following the meeting today. As a reminder too, our annual report, the 22-23 annual report, and the audited statements, which we'll get to in a few minutes, will also be available on our website in the About Us section. So as you can see, we're trying to address our current challenges. We are continuing to have issues regarding recruitment and retention, but I want you all to know that this is, of course, the most important priority for us. It seems like our recruitment efforts ebb and flow. We might be able to recruit in one area, and then another community has difficulty. So we're constantly working to address all the issues. As you've heard throughout, we're trying to not just, I guess, recruit, but we're also trying to retain. And also we're trying to augment many of the professionals that we're currently that we do not have, such as physicians, with nurse practitioners, clinical assistants, and physician assistants. So we've been attempting a lot of new approaches in our recruitment efforts, and we've been working very closely with our stakeholders, health partners, and communities. And we know that the communities have really put a great effort into the recruitment efforts, and we want to thank them very much for all that they do. We know we have more work to do, but as I mentioned before, we're working hard, and it is our top priority. I know too, and it's very distressing for many communities, that the services that we can provide in hospitals will cause temporary emergency department suspensions, month to month, week to week, and in some cases day to day. So please check our website for the most up-to-date emergency department schedules. We also send out notices on social media, and we also put out posters and notices to individual sites and communities. If I can just be a bit specific on some of the communities that we're currently trying to address the shortages, for example, Carberry. We are, of course, working with them very closely and trying to recruit. We've unfortunately had to suspend services there. We were successful in getting a second nurse practitioner to work there in the medical clinic, and we are working with a recruitment agency to get a physician in Carberry as soon as possible. We were successful in getting a new Canadian trained doctor in Deloraine, and they started in August, which is awesome. In Glenborough, we've had a recent um, retirement there. However, an international medical grad will be coming there in January. Also, there's still the nurse practitioner working there as well. In Hamiota, an additional international medical grad is coming in January. We recently had a retirement in Melita of a physician. So unfortunately, the ED has been temporarily suspended there. I want to say that we're working with the community and trying to develop a physician nurse practice model, and we hope to make some announcements over the next few months. Two doctors are still providing itinerant service there at the medical clinic, each one for 1 day a week. In Minnedosa, we too have had a recent retirement there. We have recruited another physician, and they are working at the medical clinic and in long-term care in Erickson. We've had two additional international medical grads go to Burden and one to Russell. In Killarney, we're working with an international recruitment firm, and they already have one physician signed who will start to January, and we're working with two additional potential recruits. So that's really good news. An international medical grad started in September in Swan River. You heard about physician assistants, and we have one that is splitting their time between Grandview and St. Rose, and that they are attached to the physicians. They work under the direction of the physicians, but that's a great addition to services there. If I can just say too that in addition to GPs, we're of course working on all the specialties that are required. We've had some great success. We've been able to hire an ophthalmologist, a spine surgeon, two additional general surgeons, all at BRHC. We are working, and we expect to have within the next number of months or the 3 psychiatrists starting. So that's great. And we're working with obstetrics, gynecology, recruits, pediatrician recruits, hospitalist recruits. They're all in the works. So it's great to see that we're making headway in that regard. You heard a lot about nurse practitioners and how we have them. We have now 27 nurse practitioners, and how we also have a program to grow our own. I just want to say that they are providing services in so many areas, including primary care, long-term care, acute care, the emergency department, teen clinics, youth clinics, and even at the university and colleges. So they definitely have been such an amazing asset. So beyond physicians, I just want to talk about nursing and, of course, all the other vacant positions. You can look at our website and you can see that there are many vacant positions in nursing, community health, allied health, essentially all areas in every sector. We, of course, the areas that we are experiencing the greatest vacancies are are nursing and healthcare aides. You would have heard about the Philippines overseas mission, where we're trying to recruit provincially. We've had our healthcare aide and one nurse already start. We expect that the arrivals will be coming in different stages, but overall, we expect 63 healthcare workers to be coming to PMH through that particular recruitment. You heard on the video about the capital projects. If I may just add maybe a little piece about that, and that is for the 3 ED renovations in Verdun, Killarney, and Souris, we hope that they'll be all completed in November and occupied then. For Dauphin, we were actually hoping that that would be open sooner than later, but we're actually having some issues with trying to um, um, find some of the equipment that's required. So sourcing is an issue, but it'll be opened in 2024. The Brandon Regional Health Center addition, the whole project is expected to be completed sometime in 2026. For the Western Manitoba Cancer Center, actually that could be done already by next spring, and as well with the Nipawa Health Center. It's likely to be completed and occupied in 2026. So with that, I'd now like to invite the Finance Committee Chair, Shep Castra, and our Regional Lead for Corporate Services and our CFO, Dan McGregor, to present our audited financial statements for the year 22-23. On to you.
Thank you and good morning. I'm Shep Coster, Interim Chair of the Finance Committee. I would like firstly to acknowledge the contribution and leadership of our past committee chair, Brad Collette, who previously led the Finance Committee and who retired from the board this year. The Finance Committee consists of Jenna Knight and Lon Cullen as board members, while Ian Gerard serves as a capacity of community member. The Finance Committee meets on a regular basis, generally 10 times per year, and reviews the financial status of Prairie Mountain Health. The Finance Committee reviews budgets, including monthly financial updates that are prepared by management and recommends them for approval to the Board of Directors. A variety of financial matters are reviewed at the Finance Committee prior to presentation to the Board. The Finance Committee mandate also includes the audit function with the engagement and oversight of the external audit firm and the review of audit findings for final recommendation to the Board. At this time, I would like to invite Dan McGregor, Regional Lead Corporate Services and CFO, to present the key financial highlights for Prairie Mountain Health.
Shep, I would like to acknowledge all the time put in by the board members as part of the Finance Committee and appreciate their contributions. A summary version of the audited financial statements is included in the annual report, and a complete set can be found on the PMH website, prairiemountainhealth.ca, under the About Us Regional Reports section. The auditor's report confirms that the audited financial statements present fairly the financial position of Prairie Mountain Health. The auditors issued an unmodified audit opinion, which means that no significant issues were found during the audit. On the statement of financial position, you will note that assets have decreased from the previous year by approximately $30 million. This is mainly due to a decrease in amounts due at the end of the year from the provincial government. The liabilities have also decreased from the previous year by approximately $44 million. This is largely comprised of decreases of $19 million in accounts payable, $11 million in unearned revenue, and $16 million in long-term debt. The statement of operations shows both revenues and expenses were approximately $94 million higher than the initial budget. This is mainly due to salary expenses related to the ratification of various collective agreements. PMH ended the year with a net deficit of $4.4 million, which is related to the capital deficit. It should be noted that the capital deficit is related to accounting practices that result in timing differences between the funding received and the amortization of the capital assets and does not impact the operating budget. This chart shows the allocation of expenses between various programs and services within PMH. To highlight some of the larger expense areas, the large blue area shows that 39% of costs relate to acute care services. The next largest area, 26%, relates to personal care homes. 18% includes the total for community-based services, including home care, community health, and mental health services. 7% relates to physician remuneration. And to note, the miscellaneous expenses mainly relate to items like minor capital and ancillary expenses. This chart shows the various revenue sources for PMH. 86% of the funding is from the provincial government Department of Health and Seniors Care. 6% of the funding is from the Provincial Department of Mental Health, Wellness and Recovery. 5% of the funding is from residential charges from personal care homes. And other revenue includes items such as ancillary and interest income. And that would complete the financial activities for 22-23. And with that, I would turn it back over to Lon.
Hey, thanks very much, Dan and Shep. This brings us to an end of our scheduled presentation, and now we have time for our question and answers. I'm going to turn it back over to the moderator so she can guide us through this process. We will have some time before our conclusion at 1 p.m. Back to you, Carrie.
Thanks, Lon. I just wanted to remind everyone that you can ask questions through the Q&A button at the bottom of your screen. And if you are joining us by phone, you can email us your questions at communications@pmh-mb.ca. The first question we have is, how many IMGs can PMH expect to engage over the coming months?
I can answer that, Carrie. So starting next year, we can expect to see 7 international medical grads through the IMG program each year. However, I want to talk about 2 additional pieces where there would be international grads. So first of all, we are working with a number of communities like Killarney, where we're working with a recruitment firm to look internationally for recruits specifically to PMH. So those 2, in essence, are international grads, but they're not through the international grad program where physicians who may have moved to Manitoba are not practice ready, and that program allows them to become practice ready. The ones we're working to hire through the recruitment firm actually would be practice ready already. There's a third way that we can have also international grads, and that's through the provincial recruitment process. So Canadian Health Labs, a recruiting firm, has been hired by the province to hire as many as 150 GPs for areas throughout the province. Those technically will be, for the most part, international graduates as well. And we expect and we hope to begin to see some in 2024 coming to our region. We will get a portion of that, and we're very excited about any recruitments through any of those 3 processes.
Thanks, Brian. This next question actually still relates to the IMGs, so I'll leave it with you. And it is, how does PMH decide where these IMGs are placed?
So that's a very good question. So in this past year, we actually had a total of 5 IMGs through the provincial IMG program. Where we put them was where we actually did a calculation to determine how many people were without a primary care provider. So that is the main thing that affects our decision, is the number of people that are not linked to a provider. Now, as we have more physicians come, we will be able to address more and more community needs. But currently, that's what we're using to determine. So, for example, in Carberry, where we know that we are in need of physician, we are working with a recruitment firm to specifically recruit to Carberry. But in addition, in order for emergency services to be resumed and shared between Glenborough and Carberry, for example, we would need at least 2 physicians, both in Carberry and Glenborough. And that's our ultimate aim, but it'll be through one of those 3 ways that I mentioned previously, where we'll be able to get the numbers that we need.
Thank you. The next question we have is, what plans are in place for the use of the hospital in Neepawa once the new hospital is completed?
Well, it is to replace the existing hospital. We do know, too, that that community is growing exponentially. We will be there are some services that will be added. One of them, for example, is hemodialysis, which wasn't in Nipawa previously. We will hopefully be able to do a little bit more surgery than we have in the past, and the bed numbers overall will increase. They won't necessarily all be open day one, but we do know with the projected population growth in that area that we will see the beds all gradually open, and that there will be a little bit more activity there than there has been in the past. But that facility is already, the existing facility is busy, and that's how we will be able to provide even more additional services based on the needs of that particular area.
Thank you. So another question here is, do you know how many communities are looking for physicians through a recruiting firm, much like Killarney is doing?
I'd say that we have very few communities that are not looking for a physician. And so we have a couple, like, for example, maybe Dauphin right now that is fully staffed. But overall, we are probably short physicians in every community, including Brandon. So therefore, I would say that in addition to looking for physicians, we're also looking to add additional nurse practitioners, physician extenders. So, the recruitment is going to be extensive. It's going to last for some time because we know that the whole world is looking to recruit physicians from all over the world. And we are one of many areas that is looking, but we've had some success in Killarney, and we hope to repeat that. And we also have been able to attract some Canadian trained physicians, which is great. So we're moving in the right direction.
Okay. This next question is a finance question. And are there any areas in PMH that PMH needs to cut costs? Are you content with the bottom line?
Well, we are projecting to have a deficit going into the next fiscal year. You would have known for the 22-23, we basically had a break even if it wasn't for the capital costs that Dan mentioned. Going into 23-24, that is not the case. Our costs are higher, but not for any, well, I'm not going to say not for any other reason, but primarily because it does cost more to pay for overtime and to pay for the additional costs related to agency. Once we're able to attract and retain more providers, those costs will go down. But we are projecting to have a deficit, which is not typical for PMH. But we really have no opportunities to cut costs in that area because we're trying to provide all the services that we've always provided. And accordingly, those costs for overtime and agency will be inevitable for the next coming year.
Okay. Another question we have, they're flying in right now. How many communities are putting municipal dollars into doctors' recruitment firms?
Right now, we're speaking with 5 communities that are doing that. So that's quite substantial, and we appreciate what those communities are doing. Obviously, they're committed to, as we are, to bring physicians to those communities. So that's great.
Okay. Now another question, has there been a reduction on spending for agency nurses, or is this the same or more?
So no, we haven't made any reduction to spending on agency. We've looked for agency based on our needs. I will say, however, that probably the area that is increasing in terms of agency needs are healthcare aides. Nursing is going up slightly, but healthcare aides by far is the area that we're probably the most short right now, and I think I mentioned that previously. So anyway, it's interesting how we're having a greater difficulty finding healthcare aides.
Mm-hmm. Okay. With a large focus on illness treatment and building PMH health services stronger in the future through recruitment and retention efforts, what is the vision for prevention, early detection and screening, primary prevention and health promotion, for example, in Prairie Mountain Health?
Well, that's a very good question, and we didn't really highlight those areas as well as we could have. So as you know, there's a number of initiatives, and we talked about um, um, bringing services to First Nations communities and our access centers throughout the region. And really, there is a lot of preventative and protective work done through those clinics. So that is very, very important work for us. And of course, we try to stress those areas that are in the greatest need. So if you see that we have particular services in an area, it's because that's where we're deeming that we should be directing our services to. But you are correct. But provincially, I will say we're all working together to address more prevention. And we are in the future, you're going to be seeing more related to virtual care or remote monitoring. Those are opportunities that we haven't seen much of in the past. Maybe during COVID, we did a bit. We'll also see probably more services for seniors, which is another prevention. Having seniors be able to stay in their homes as long as possible safely is important. So those are just some of the things that I can think of where there are efforts underway to do more in that regard.
Okay. The next question, and I believe it goes back to, I'm just looking back at the other questions, as to how many communities are putting municipal dollars to hiring physicians. Yes. This next question is, are you able to say what those who those 5 communities are that you had mentioned?
Sure, I have no problem with that. So Killarney was one of them. We also have Carberry and Glenborough. We have Grandview and Roblin, and there's one other community that's considering that, but I won't mention their name. But the other, I think what's important to mention here is those 5 communities are looking specifically working with a recruitment firm specifically to hire a physician. But there's many communities that are assisting us in various ways with recruitment. Both nursing and others. So for example, it might be housing, it might be an incentive of some kind, not just for physicians, but for other as well, or it could be through some other means. So I just want to make a call out to the communities, all the communities that are helping us, and we're working together to try to recruit to all of our communities.
Thanks, Brian. I'm just looking, I don't believe we have any other questions here in the Q&A area right now. Maybe I'm just wondering if there's any more that will come in.
And I guess we could always respond to those directly.
Okay, yes, we can. Yeah. Oh, and then we have a comment. Thank you very much for answering all of these questions. It is much appreciated.
Absolutely.
So we have no more questions right now. I believe this will bring us to the end of our question and answer period. So Lon, I can pass it back over to you to adjourn our meeting. Sorry, Lon, I'm going to have to unmute him here.
I think after 3 years of the pandemic, I would know this by now.
I think that was partly me too, Lon.
I guess I'd like to say thank you very much to the team who helped put this annual general meeting together. And I particularly value the questions that come from the various participants out in our communities, which we are trying desperately to serve to the best of our ability. Thank you very much to Brian, and as the CEO who leads the ship on here, and I know Brian would defer credit to all of his executive management team and all of the employees out there. So in closing, I'd just like to thank everyone who joined us today, and we will have the video at the end, available at the end of this meeting posted. Thanks very much and have a great day, everyone.